Well, I'd like to welcome you, Dr. Cazzoli. Thank you so much for meeting with us this morning. My name is Eleni Milios. I'm the CEO of the Cure Starts Now here in Australia. And we've got Keith online as well, who is the founder of the Cure Starts Now International. I would, on behalf of the DIPG and DMG Collaborative, we've got some great news for you today. We have agreed to fund the first aim of your project for a total of $50,000 US dollars. We are
Thank you very much. Thank you very much.
No, thank you. Nice. Thank you for the work that you do for our cause and for the greater good. So I'll hand over to Keith now, and he'll take it from here.
Okay.
Well, yeah, certainly congratulations. As you can tell, this is obviously an international effort or international group that looked over your grant and was impressed with the strategy of it. In particular, the discussion of red blood cells and kind of using those as your delivery vehicle for that. Would you mind talking a little bit about what the concept is there and how that's different from some of the other work that's being done currently in this field?
Sure. First of all, thank you very much. I really appreciate it. It's fantastic news. Talking about the concept of the red blood cell. This is one project I'm working on from several years. It's almost 7 when I was in Japan, and then I moved to Italy and I followed up. So we are trying to create a technology that can load any kind of molecule and deliver to the target cell. And our idea was to use something that mimics a structure that is present in the bloodstream. So in this way, we tend to minimize any immune reaction. So the immune cell will not perceive it as something that it's supposed not to be there, as all the other delivery systems that are commercially available. And the big improvement is basically there is no inflammation. That usually is something that fuel the tumor microenvironment. The drug is encapsulated inside this vesicle from the red blood cell, and so there is no direct interaction between the drug and the system. In this way, we drop down the toxicity. And plus, what we are trying to have a proof of concept in this particular project is our ability to deliver 2 different agents. In this way, what we plan is to try to not only target the tumor cell because the molecule are going there, but also target a specific pathway that probably are not present in a normal cell. In this way, even if there is a sort of course, a bit of off target will always be, it will not be harmful for the healthy cell. So our idea is to minimize the risk first and drop down the toxicity. And we are working on this basically from almost 10 years. And now we are on the edge of testing this technology that has been approved as a patent recently this year. And now what we want to try is really make it effective against one of the most critical tumor pathology we know. And I moved recently actually to Sydney. First I was in Italy, and I was not working on brain cancer at that time. When I arrived here, I really felt like this is something terrible. I never experienced a pathology such as the DIPG. It's something really massive. And also on the point of view of the feeling, I was thinking like, I need to try to do something, and this technology can be a good test, let's say, because let's see how it goes, the testing, hopefully well. But what I really want to reach is a proof of concept, in the meaning like this technology is extremely flexible. So it's not limited on this particular 2 molecule, but we can decide to modify the technology to deliver other type of drug, other type of gene interfering. In this way, we try to use this project to give the idea that we are able to deliver anything we want. And then it's just a matter to find the correct combination. And if we achieve this, we open up the field like just to continue to study and find the perfect match between 2 drugs that have the less toxicity and the maximum effect on them.
Well, and that's what we saw on the grant, is we saw this wonderful combination of kind of this targeted approach. Obviously, you use target in some of the grant forms that you have here, or the acronym target, but also the ability to be able to expand upon it and to try to grow this. So we're tremendously honored that you do this. Speaking from not only a charity perspective, from a father, I lost my daughter to this type of cancer. We feel it every single day, and we just want to celebrate your grant, but also very much look forward to the conclusions and the updates on this as the project moves forward. So congratulations once again.
Thank you.